Related news: health experts have called on the federal government to redouble efforts in establishing funding for cancer treatment, which constitutes the highest cause of medical tourism. The experts made this call in Abuja on Tuesday at an oncology conference, where they converged to discuss the way forward for cancer funding in the country. According to WHO estimates, cancer is one of the highest killer diseases in Nigeria, as 100,000 cancer deaths are recorded annually, while 250,000 new cases emerge yearly. The key speaker, senior health specialist, International Finance Corporation (IFC) of the World Bank Group, Olumide Okanola, in his presentation titled, "Funding Cancer in Nigeria, The Way Forward," advocated for special funding for cancer treatment in the country. He expressed worry that the consequences of cancer affliction in Nigeria was worse among poor rural dwellers, adding that the government should take a more pragmatic approach towards stemming the tide of cancer in the country. We need to recognize and emphasize on public financing. Nigeria is spending the lowest in public health financing. We need to upscale it, he said. Mr. Okanola called on the government to dedicate funds accruing from the Federation account, tax on alcohol and tobacco, lifestyle taxes, seized loot, etc. towards funding catastrophic health challenges in Nigeria, while suggesting other options for financing cancer infrastructure in Nigeria to include public financing, blended financing and commercial financing. He called for the implementation of the National Health Act, situation of the administration of the Cancer Health Financing (CHF) in the National Health Insurance Scheme (NIS), and the need to engage with the Bank of Industry (BOI), and Central Bank of Nigeria (CBN), and other financial institutions on how to explicitly benefit from concessionary financing for oncology in Nigeria. Meanwhile, the Minister of Health, Isaac Adewole, expressed the commitment and determination of the government to mitigate the effects of cancer in the country, adding that in the next 6 months government would deploy 8 to 12 new machines for oncology. Mr. Adewole, a medical professor and a specialist in oncology and gynecology, said radiotherapy was not the only way of treating cancer. He added that there was a need for a nationwide awareness campaign and screening exercise for cancer.